Hello. This morning I'm going to be giving a short in-service on a product from Containmnet called the Flexi-Seal Signal. This product is something we have in the hospital already. Cindy Fagnet and I went to a meeting with the sales rep from Convatec to find out about this product and how we could use it. This product is actually designed for fecal incontinence and help stop the spread of C. diff. I know it doesn't sound very exciting, but when we did hear the topic, we're kind of like, okay, this sounds like something different. How does it work? So it kind of sparked our interest. And then it even sparked our interest more when we found out we actually have one. It's located in the ICU. We have not opened it yet, have not used it. But learning about it, I think there are applications where we can use this at some time in our facility. So this system, if you take a look at the handouts that I provided with you, this first one kind of just gives an overview of the different parts of the system. It basically is like a Foley catheter for the fecal system of the body when you break it down to it. It has, if you look at the very top of the sheet, where it starts with the balloon all the way down to the collection bag. And if you want to refer to the enclosed card that I gave also, this kind of gives everything in a bird's eye view of the individual components highlighted so it's easier to identify. So basically the balloon at the top is inserted into the rectum, where a balloon is then inflated, and that balloon sits right at the sphincter there and causes a seal, where the liquid feces is then drained out through the tubing into the collection bag, with the collection bag pretty much like an ostomy bag. Okay? So, of course, the first thing you want to do is make sure you have a very good pair of gloves, okay? And then you want to make sure that if Kristen is in the room, make sure she is far enough away because she won't be able to stop giggling the whole time. So, the system is designed to be inserted. There's 2 ports, you'll notice, halfway down the drainage tube. One port is for the inflation, and with that inflation device, you don't want to overinflate it because you actually want the balloon inside the cavity to be soft and pliable so that with the weight and pressure it actually conforms to the sphincter so there's less leakage. The other port is a access port where you can flush the tubing in case there's any type of clogging, and also you can take samples, stool samples, off of that port also, so it's very convenient. The best thing about this is it's a closed system. The entire system is closed. And as you know, this pertains very well to the problem of C. diff and transference of the C. diff. Of course, C. diff spores can survive for up to 5 months in an environment. It can be acquired from contact with contaminated surfaces, from one patient to the nurse, and then to another patient. And it can also be transmitted through the air, those spores that are left in the room. So as you can see, this closed system helps eliminate those problems. With proper infection control, the use of the Flexi-Care signal system actually helps attribute to a 50% reduction in the C. diff in certain facilities. Of course, C. diff, when we think about that, it's something we don't like to see, but on a monetary cost, patient with C. diff, their bill cost of care actually goes up about $13,500 for the treatment of the patient. Their length of stay is increased by 3.5 to 4 days. And of course, increased nursing time. They're on isolation precautions. More time with you in the room taking care of them. Also, it increases time as far as housekeeping and cleaning, special procedures and cleaning the room when they're discharged. And of course, also a patient that comes down with C. diff then they require additional antibiotics. And as we know, antibiotics can cause C. diff in the first place. So this system is great for helping prevent that. The system pretty much is self-contained, very little maintenance. On the third part of the handouts, I gave a step-by-step instruction on how to use it. It's a pretty neat guide, so if you want to take a peek at that. The website, www.convatec.com, if you look under fecal management, they actually have some good videos, some great resources about using this system. So please check it out. I think you'd be pretty curious at the use of this device, but I think it definitely could be used. I'm thinking of one instance where we had a very large patient that was immobile. She had an external fixator on her lower leg. She was obese. She already had skin breakdown on her body. And we had to actually get a special bed brought in to help manage her skin issues, weight distribution. That bed required special sheets that we had to use. So you can see the savings and cost something this would have on a patient like that. I think if we think back, we can think of many times where we've had a patient with C. diff or loose liquid stools that took a lot of maintenance, a lot of nursing care, and this would definitely aid in making our jobs a little easier. So check it out. Keep it in the back of your mind. It's nothing we'll be using a lot or anything. It's no major breakthrough, but it is definitely something that we should be aware of, that we have this option. One, to make the patient more comfortable, help with their dignity, help reduce the risk of skin breakdown, and help reduce the risk of spreading infections like C. diff. I appreciate your time. I'd be there right now if I could, but right now I'm in Indianapolis and hopefully enjoying that, and I will see you when I get back. Thank you.